So, welcome back, guys. Thanks again for joining me again on Black with Vascular here. Again, we're here to educate. We're not here giving medical advice, but today's education is about peripheral arterial disease and basically just giving you guys some basic statistics based on this article and some other articles I've been reading. And if you really want to figure out what peripheral arterial disease is all about, these are the kind of articles that you need to actually look up. You can't just go to Google and Google things. You actually have to go to peer-reviewed journals written by reputable hospitals like Johns Hopkins here and really read through in detail. And I would recommend to you guys, copy and paste into ChatGPT, line by line, if you can get a hold on one of these articles, and have it explain it to you in normal terms. What do these numbers mean? You don't have to be a statistician anymore. With ChatGPT, you can have it convert a lot of this. And yes, it will not always be accurate. But I tell you what, I dare say it's more accurate than most of what people are getting in terms of education these days. So with that said, let's talk about peripheral arterial disease briefly. So peripheral arterial disease is a major problem in America and in the world. We're talking about 7% of Americans having PAD, around 8.5 million Americans. So that's a huge number. This data was mostly collected in the 1990s, and I think that there has been a rise in PAD, over the last 15 years since that data was collected. But the whole point of it is, I'm saying this is not a very non-common problem. This is quite common. PAD is defined by what's called an ankle brachial index of, when I say PAD, I mean peripheral arterial disease in legs, because you can have multiple vessels affected, polyvascular disease, including cerebral disease, which is affecting the neck, mesenteric disease, blood vessels for the intestines, kidney vessels, that's called renal artery narrowing or renal artery stenosis. Even arteries of the arms can be affected, but for the most part, what we're talking about with peripheral arterial disease is lower extremity disease. And the lower extremities meaning from in your pelvis and downward to your toes. And so how do we figure out if a person has peripheral arterial disease? Well, we do what's called an ankle brachial index. We just check your blood pressure in your ankle and see, is the ankle pressure you put that as your numerator over your arm pressures in your arms, assuming that the patient's arms have very little disease. And so by doing that, if your ankle pressure over your arm pressure, your brachial pressure in both arms is less than 0.9, it would almost feel as if it's like 90% of what you like. Basically think of it like you're getting 90% or less blood flow to your ankle than you would get to your arms, which we're going to assume is your true pressure, which is not always true. But if you do it that way, then you'll define PAD as anybody with 90% or less blood flow going to their ankle. Now, I'm saying percent because I'm trying to make it simple for people. It's not exactly a percentage, but that's the general concept. And so if you're in that 0.9 or lower, you have officially PAD. And so that's 8.5 million Americans. And as you get older, PAD risks increase. So there's multiple studies that show that people who are older have a much higher risk of PAD compared to people who are younger. What else can we tell about PAD? PAD is a lifestyle, can be somewhat of a lifestyle issue. So patients who are kind of just sitting around and more sedentary are more likely to have PAD. There was one study that I looked at where it shows, which is a Journal of Vascular Surgery study, where it shows that people in America and Canada, it was, I think, almost 4,000 people per 100,000 people in all ages. And when you look at that picture compared to, it was a global map of the entire world. And when you compare it to, let's say, Africa, in the same time period, 2019, Africa had like 10 to 750 people. So like imagine 400 people. Let's just pretend most of the African countries have 400 people with PAD for every 100,000. Meanwhile, America has 4,000 for every 100,000. So that's a 10 times increase. And then the same thing goes for Europe and the European countries, all these first world countries where we have cars and we don't walk as much anymore, and we have lots of access to cigarettes and we have high cholesterol, it really has become a disease of developed countries. And so people who are poor and doing a lot of walking and doing, India and, more the developing countries still, um, although that is changing these days too, those countries are still somewhat protected. And so there's a lot of good studies that show that just a huge amount of interesting data when it comes to where PAD is affecting and who. So we're going to go along in this series, and we're going to talk later about how to test in more detail and how to make diagnosis, additionally risk factors outside of just smoking and not walking, things like diabetes, high blood pressure, etc. And then we can get into more details. But I'm hoping to do like a little bit of a lecture series here. Again, part of what really inspired me here was this article that showed that people who have PAD and have claudication, pain with walking, and do not have a surgery or a procedure actually do really well and don't end up with amputations. So that was what inspired me to start off on this whole series. And so I'm just going through little by little and making a series for you guys. But if you guys like these videos, like and subscribe to my YouTube channel and follow along and ask me questions. Email me at blackwoodvascular@gmail.com. All right, thanks.